Welcome back to Teaching Tuesday, and let me tell you why I have this handbag. It's because I want to talk about skin quality and why it's important in surgery. Okay, so technically, in surgery, I or someone else can do a great job repositioning skin, especially when you're tightening something, lifting, facelift, arms, pulling down on a tummy, thigh lift, whatever. Okay, so we do the maneuver, and how long does it last? Well, it really depends on the quality of material we're working with, the strength and the elasticity. Okay, so if I'm lifting on something and I want it to stay, do I want to be lifting with something strong, like leather, which is dermis from an animal, right? Or do I want to be lifting and trying to hold up a thigh with skin that's as weak as saran wrap, and it'll stretch over time? I'm stretching it right now, and that's actually what happens. You can do a thigh lift maybe and pull it all the way tight, as tight as you can get it, and then there is some relaxation over time. How much? Depends on the material. So one is how strong it is. The other is how much elasticity is left. Let's say you spent your life in the sun and you have the thin but brown, crepey, leathery, alligator appearing skin. It's lost elasticity. In fact, that appearance is called solar elastosis. So let's say I'm pulling up on tissue, right? And there's excess skin in the neck, right? And then I pull up and I can put some extra stretch on it, right? And get the neck skin tight. Okay. Let's say we get some of that relaxation that I talked about, and it comes down 25%, well, it's still tight, right? Let's say it comes down 50%, still tight. And that's because it's elastic. But let's say we go back with something that's not elastic at all, that sun-damaged skin, and we get up here tight. The minute it relaxes, the minute there's any relaxation, it starts to sag. It starts to fold again. Okay, and here's another example. I can pull, here's some wrinkles on a thigh or in a neck, and I pull it tight, okay? But there's no elasticity, so as soon as it starts to relax again, even in the weeks after surgery, you start to get the folds again. All right, so it's not just the technique. A lot of it has to do with what kind of material the patients bring to us. We want leather, like the purse, versus something that's weak, that's going to stretch out after the surgery. And we want something elastic, so when things do start to relax, we still have tightness, and it doesn't start to get redundant and fold over again. So it's not just what we do, it's the materials that we get to work with that are different from patient to patient.